Hi everyone, and welcome to our latest edition of Facebook Live. My name is Jennifer Williams, your host for today. I'm so excited to sit down with my friend and acute care surgeon, Dr. David Burler. We know having an emergency and needing surgery can be scary, but we have an excellent team here at Cooperman Barnabas Medical Center to help you through. So today we're going to discuss the basics of acute care surgery, what you need to know when you're coming into the emergency department, and so much more. So if you do have a question for Dr. Burler, leave us a comment below, or even if you just want to give him a little shout out. And please help me welcome Dr. David Burler. Hi.
Hi, thanks for having me.
I'm so glad that we're getting to do this, because I did say, I like to say this is my friend, so it's nice that we're getting to sit down in a professional setting and have this discussion. So let's just jump right in and start with the basics. So tell us about what an acute care surgeon does and what is your role here at Cooperman Barnabas Medical Center?
So an acute care surgeon is typically a general surgeon who works in a hospital or affiliated with a hospital and takes care of patients who come with complex surgical problems that fall within the realm of general surgery. Most of the time, but not always, that usually involves an abdominal surgical problem.
And, you know, in terms of being an emergency and needing surgery, you know, we can't always plan for that, but they can happen. Walk us through the process of entering into the emergency department and meeting your care team. And if you do get that news that you do need to have surgery, kind of walk us through that process.
Sure. So when a patient arrives at our hospital, we have a state-of-the-art emergency room where our team, our staff is excellent. They have all the resources that are state-of-the-art, modern, imaging equipment, laboratory obviously, and low wait times, so they'll get taken care of expeditiously. Mm-hmm. Generally, the workup is done by the emergency department staff. And if during that workup it's determined that there is a surgical problem or a potentially surgical problem, the surgical team gets called. There is a surgical team that's in-house in the hospital 24 hours a day, 7 days a week, 365. Mm-hmm. So there's always someone available to take care of you if there is determined to be a surgical problem.
And they're a really excellent team, and you're truly in good hands, and I truly am not just saying that. People tend to put off when they're not feeling well and just kind of brush it off to the side and say, you know, it's okay, you know, it's just my stomach, it'll get better. How do we know when it's that point when we kind of shouldn't deem something as minor and that it is more serious and that we should be visiting the emergency room?
What I generally tell people is that if something really doesn't feel right, it's probably not. And it's always better to err on the side of caution when you think something might be going on that's out of the realm of normal for you. Mm-hmm. You know your body best, you know what's typical for you, better than any doctor or any test can tell you or determine. So if you feel like something is off, or you would be most comfortable coming in, having us evaluate you, and you're concerned that there might be a problem, then you're always welcome here, and we're happy to take care of you. And if there is a problem, then there's a surgery as well.
And what kind of surgeries do you typically perform?
I would say that the most common problems that we see at Cooperman Barnabas Medical Center are acute appendicitis, which is acute inflammation of the appendix, acute cholecystitis, which is inflammation of the gallbladder, usually secondary to gallstones, mm-hmm. And other small bowel and colon associated problems.
Is surgery always the first and only absolute option, or if different cases present maybe different treatment options for patients?
I think that our job as surgeons is to present various plans to patients, give them different options that work for them, and so that they can make an educated decision according to their values, mm-hmm. Their wishes, and for them to make that choice. And we can present that information. As surgeons, it's our obligation to present what we think is the best choice, or the medically speaking, the best choice, but we collaborate with patients and their families to allow them to make that choice independently, and also to have some autonomy in that decision-making process. Mm-hmm. Oftentimes, surgery is the standard of care. I think a good example of that is something like acute appendicitis. by and large, I would say 90% of the time, laparoscopic appendectomy is the standard of care to surgically remove the appendix and address the underlying problem. But there are scenarios where a non-operative approach might be more appropriate. One of them is if a patient is older or has more significant medical history or problems and might not be able to tolerate a large surgery or be under general anesthesia. Another is a case where it's either very early appendicitis or appendicitis, the opposite end of the spectrum, where there's been a perforation. In those scenarios, management with antibiotics first. There's pretty good surgical literature and evidence that many patients will make an uneventful recovery from their appendicitis and might not need to undergo surgery in the future. But we present all these options to patients and try to help guide them through that process so that they can make a decision and feel empowered by that decision and comfortable with it.
And tell us a little bit about the team here and the vast amount of people. You know, it does take a village, as they say. Tell us about the team and their roles in patient care.
The Department of Surgery at Cooperman Barnabas Medical Center is a full complementary service with surgeons, obviously. We have a residency program that's through the Rutgers program, physician assistants, nurse practitioners, and of course our expert staff of nurses on the floors in the wards and of course in the operating room as well. So you know that when you come here, you're going to be receiving expert care, multidisciplinary care. We really focus on having a team-based approach to all surgical patients, oftentimes who are very complex. And we each bring something to the table to help ensure the best outcome possible for patients.
And sometimes too, when you go to the emergency room, someone might not necessarily see you, the surgeon, right away, or the doctor, but you know, it's good to reassure people the PAs and the NPs and all of the staff are truly qualified in their roles and are going to do everything they can to take the best care of you. So that's always important to just remember too. You know, their team really is so vast and there's so many wonderful people here that you'll meet. So with that too, I know you got very excited recently. There was some new robots and things and different technologies that you're using in surgery. So why don't you tell us about these new advancements?
So at Cooperman Barnabas, we always want to be on the forefront, cutting edge when it comes to innovation and what we can make available to patients vis-a-vis surgical technology, if you will. So within the realm of acute care and general surgery, we tend to try to offer minimally invasive procedures for patients wherever possible. That allows for less postoperative pain, earlier return to work and function, and cosmetically speaking, fewer and smaller scars. So we try to employ that whenever we can. Sometimes it's not possible. And we use the Da Vinci robotic system. We have 4 of them at our hospital. And that allows us to really get a good view with a camera, a 4K camera, at everything going on the inside. It's crystal clear image. It allows for very fine dissection and tissue manipulation, suturing, of course. And that allows us to really be at the forefront of what we can offer patients.
It's really amazing what you all do. We recently have an opportunity to watch a surgery, and it's just so incredible. Like, I get so wrapped up in how tiny everything is, but you're like artists, it just makes it work, and you really do take such care in what you all do, and that's what makes you the best. And sometimes, you know, we've kind of been alluding, you're coming in here and you don't know that you're gonna need surgery, and you know, that's so scary for people. How important is it for you to establish trust with your patients and your families before entering into a situation where they may need some surgery?
I think for our group, and there are 4 of us acute care surgeons, and for me in particular, my philosophy is that a very big component of what connotes success or a successful operation, a happy ending for a patient's story, is whether they've had a good experience and whether they felt comfortable with their surgeon, whether they felt confident in their surgeon, and whether they had a good experience overall throughout the process, as difficult as it can be. So I really bring that to my practice. I try to treat every patient as if they're a family member, and oftentimes I tell patients that whatever I'm recommending on any case, that this is what I would recommend for a family member of mine, because I want them to know that we care about them, that we want to see them through this difficult part of their lives, and that we're really trying to do right by them and to do the right thing to get them well.
I'm so glad we've had this opportunity today for people to kind of get to meet you and know you. You know, it can be scary when you come into the emergency department or needing surgery, but truly you have 4 amazing surgeons here, an amazing team, and you really truly are in good hands. Is there anything else you'd like to add today?
I think that you would be well served if you have any surgical problems or any problems at our hospital. We have every offering at our hospital. It's right here in our backyard in New Jersey. So we're here if you need us, and we hope to see you soon.
And we'll pin the acute care surgery department website in the comments. And you can always ask your questions, and we'll make sure we get them over to Dr. Burler. So thank you for being here today. I appreciate you. And we will see you all next time. Thanks so much. Bye-bye.